How much does a clinical pharmacist earn? In the spirit of trying to demystify clinical pharmacy as per my recent videos, I thought I would continue the theme and talk about my salary. Hello everyone, my name is Osama. For the past 24 years I've been working as a pharmacist in England. Welcome to my channel and thank you for spending a few minutes of your time with me today. It's very much appreciated. It's always a pleasure. I bet some of you are wondering about how the pay of a clinical pharmacist compares to that of a pharmacist working in the community. Of course, we know that salary is just one metric that we can use to gauge job satisfaction, but nevertheless, I think it's an important thing to chat about, so let's get into it. So in the pharmacy that I used to work, it was a Monday to Friday 9 to 6 job, so that was 45 hours a week, and the pay was £44,224.37 to be exact. So to give you an idea, that pharmacy that I worked in did about 6,000 items a month on a good month. We had 30 nomad trays, about 16 substance misuse clients. So I think all in all, the pay I think was probably right for the workload of the pharmacy as well as the overall responsibility that I had. So what do I earn now then? Well, before I get into that, let's just rewind all the way back to March 2022 when I first started my job as a clinical pharmacist in the primary care network. So my starting salary as a clinical pharmacist in the primary care network was £45,729. So that's a slight increase on what I was earning, but bear in mind it's for less hours. So I was getting paid a bit more money for doing a 37.5-hour week versus a 45-hour week. As you may or may not know, when you come into primary care pharmacy, you have to do the PCPEP course, which is the Primary Care Pharmacy Education Pathway, for 18 months. Then following completion of that, you then have to do another 6 months, which is your independent prescribing course. Now, I already did my independent prescribing way back in 2017, so I only had to do the PCPEP course for the 18 months. In our PCN, we have a thing where once you complete both courses, you can then apply for a pay rise, and that is exactly what I did. So upon completion of both courses, I did in fact apply for the pay rise, and that took my salary to the grand total of £50,635, again for a 37.5-hour week. You could argue that being a prescriber, maybe I should be on more money than 50 grand, but then again, it is only for 37.5 hours a week, and also I do work from home on a Wednesday, which I'm sort of neutral about, but for some people that might be a huge bonus, working from home on a Wednesday. So that's it in a nutshell. If you look at the additional roles reimbursement scheme document, I'll put it up on the screen, it gives you a table as to what the maximum reimbursement is per role. So I'm just having a look on my iPad now. For the clinical pharmacist, it's £59,312. So there's still a little bit of room to go before I hit the maximum reimbursement for that role. And I would imagine that ceiling is probably reserved for those senior clinical pharmacists who potentially have a lot of experience in the role, or have took on some, say, management responsibilities within the primary care network. I'm quite happy with the salary, I would say, for the moment, and also obviously working for the NHS, you're enrolled within the NHS Pension, which is one of the best because it is a defined benefit pension versus a defined contribution pension. And in this day and age, getting a defined benefit pension is really hard to come by, so we have to take that into account as well. As time goes on, I think I may well try and negotiate a higher salary because I do a lot of work outside my core responsibilities, but I will leave that for another time. So I hope that shed a little bit of light into the type of salary differentials that you can expect to see between community pharmacy and primary care pharmacy. Now, I do know that since the primary care network recruitment started a few years ago. Community pharmacy have had to up their game and become more competitive, and they have gone to offer some amazing salaries for new starters and for other pharmacists as well. But I do expect those rates to potentially dip again as the primary care networks across England have more or less finished recruitment. So I expect the pharmacy workforce to go back into equilibrium. So I won't be surprised if the rates sort of dip slightly going forward in the future. Obviously, if you're in quite a busy pharmacy, you will probably end up earning the same as what I'm on, you know, about the 50k mark. Like I said earlier, salaries isn't everything, but I think it's important to talk about these things. In British society, it's a bit of a no-no to talk about these sort of things, but I believe in sort of openness and sort of bringing more exposure to these so-called taboo subjects. So that concludes the video. Let me know what you think. Let me know if there's anything that I've missed out. Let me know if there's anything that you want me to cover in the future. So, you know, just give me a shout. But anyway, it's been lovely again speaking to you all. I will see you all again very soon. Thank you very much once again. Catch you later, guys.